about what is personal protective equipment, and I will be explaining about it throughout the video.
Hi, my name is Miriam Kazadi. We're gonna do PPE, and my role is to demonstrate the activity of how to use PPE properly.
Hi, my name is Denis Katabazi, and I'll be behind the camera recording the whole project.
Personal protective equipment. Personal protective equipment, or PPE, is used to protect the healthcare workers from exposure to infectious agents in healthcare settings that include special clothing or equipment such as glove, gowns, or mask. Infection can be spread to a susceptible host via contact, droplet, or airborne routes, and precautions must be taken to prevent the spread of infection. So the type of PPE that are available are gloves. They are used to protect the hands and are worn when in contact with blood, body fluids, mucous membranes, or other body secretions and excretions. The gowns, they are required when doing patient care where there is a risk of spray or splash of blood or body fluids to protect uncovered skin and clothing. The mask, which includes N95 mask and the regular face mask, used to protect the mouth and the nose. The eye protection, such as the goggles, are used to protect the eyes, and the face shield is used to protect the nose, face, mouth, and eyes. Don PPE outside the patient's room. Perform hand hygiene with soap and water or alcohol-based hand sanitizer. Then don the gown, making sure the gown does not touch the floor. Securing the ties around the neck region. And then around the waist region. Making sure the gown covers the back completely. Next, don a face mask. Make sure the metal part is snugly fit over the nose. And then it covers all the way from nose to the chin. Okay. Then don the eye protections such as goggles, making sure the goggles snug tight on the face, but not too tight. Then don the gloves in the end, and making sure the gloves cover the cuffs of the gown completely. PPE before leaving the patient's room and in a specific order. You must first be able to identify what sites are considered clean and what are considered contaminated. The gloves are most contaminated and are removed first. Remove the gloves from dirty to dirty and from clean to clean. Discard the gloves into the garbage and perform hand hygiene. Then remove the goggles, making sure touch only the outer part above the ear and do not touch it from the front, and discard into the appropriate receptacle. Perform hand hygiene. Then remove the gown. Starting from the waist, untie and then untie around the neck. Make sure not to touch the outside contaminated part of the gown and rolling the gown away from you. Make sure it does not touch your body. Discard the gown into the appropriate receptacle. Perform hand hygiene. The last thing to remove is the mask. Remove the mask from holding the ear loops. Do not touch the outside contaminated part of the mask and remove it away from you and throw into the appropriate receptacle and perform hand hygiene.
So to summarize our project, we're going to talk a little bit about the specific precautions. I'll be talking about droplets. Infection caused by microbes are transmitted by droplets produced through coughing, sneezing, talking. Organisms that are transmitted are rubella, influenza, mumps. The patient would have to be in a private room. The mask worn should be worn within 2 meters of the patient, and it depends on the facility requirements.
Infection can be spread by contact route. The contact route can be direct or indirect. Direct route means if you touch the contaminated patient, or indirectly if you touch any equipment that has been contaminated with that infectious pathogen. For contact precaution, it involves the use of gloves and gown and required when in contact with patient with known or suspected infectious diseases such as major wound infection, C. difficile, MRSA, gastrointestinal, respiratory, or other skin infections.
Talking about airborne precaution. Airborne precautions are required to protect against airborne transmission of infectious disease, and the disease requiring airborne precaution include but are not limited to measles, severe acute respiratory syndrome, varicella, chicken pox, or Mycobacterium tuberculosis. Preventing airborne transmission requires personal respiratory protection and special ventilation and air handling. Wear an N95 respirator, prior fit test that must be repeated annually, and fit check. Seal check prior to each use. Prevent air purifying respirator. The respirator should be done prior to entering the patient room and after exiting the patient room. The room should be provided with negative pressure with minimum of 6 air exchange per hour. So I will just show how to wear the N-mask. Just you fix it on your nose and you have to make sure it's fit properly so that the air should not be escaping from your nose. So you put it and then you make sure it's fit properly on your nose. And that is how we do it.